We've had a question, or a statement and question. 3 is post-transplant with blood still struggling to meet normal range. And so consultants have mentioned reactive T cells, and is that a common problem after transplant?
I'm not too sure what they mean by reactive T cells. It really depends upon why the counts are low and how low they are. If your child is still having transfusions, then that is a problem. Or if they're getting recurrent infections, that's a problem. It says they're not doing their job right. If their immune system hasn't recovered, which that may well be the case, then that's sometimes what can be done, and I don't know the specifics of this case, is to see how, so for example, how, if the immune cells haven't recovered, sometimes depending on how cellular the marrow is, we could potentially approach the donor again to ask something called a top-up. I don't know if the team have discussed that. It really depends upon if it's just the B cells or if it's other cells as well. If it's just the B cells, then you carry on with immunoglobulin. But if it's affecting other cells as well, and that's causing a big problem, then that might be something to discuss with the team. I don't know the specifics of that, and that's, it may well be that they're happy with the rest of the counts, they'll carry on with things. But sometimes post-transplant, the counts aren't good enough. We sometimes go back to donor. It's a bit like having a top-up from like your petrol station or something, asking whether you can infuse some more cells. Doesn't normally mean you have to be admitted. It's normally done as an outpatient procedure. And that might be something that might be beneficial if more than just the B cells are low. So it's something to consider and discuss with your transplant team.
Thank you. And there was a thank you in capital letters in the chat as well. I don't know if you spotted that.